Welcome to Medicare for All Explained. This podcast will enlighten our listeners and dispel the distortions that surround Medicare for All. Medicare for All Explained is produced in collaboration with Physicians for a National Health Program and is hosted and produced by Joe Sparks. I'm your host, Joe Sparks. This is episode 71, Medicare for All Changes that will make your life better. What I would like to do in this episode is discuss the changes that will happen under Medicare for All that I think will profoundly change lives for the better. I tend to get excited about major changes that Medicare for All will bring to the United States, and I can rattle off some of these changes. More than 68,000 lives saved every year, more than $415 billion saved on national health care expenditures, and an end to any more medical debt. While an end to any more medical debt is a major change, it's also a change that I think will make people's lives better. So I would like to start with that. I said earlier that Medicare for All would end any more medical debt. That's because Medicare for All would end out-of-pocket costs. Under Medicare for All, there would be no charge for medical services at the point of service and be no charges for prescriptions. This simple but important change would mean that any person or parent could always get medical care for themselves, a child, or loved one without having to worry about whether they could afford the care. There would be no charges and no cost concerns. Before COVID in 2020, there were more than 40 million people who were underinsured. This means they had insurance, but still could not afford medical care or prescriptions due to high out-of-pocket costs, such as deductibles, co-payments, or coinsurance. Underinsurance ends with Medicare for All. Another important point is that there will be no one without health coverage, since everyone is covered with Medicare for All. This means that the more than 40 million people who were uninsured before COVID would now have health coverage. Note, some of the stimulus programs created to deal with COVID have reduced the number of uninsured. While estimates can vary a bit, there are probably around 30 million uninsured people now. To put this in perspective, about 1/4 of adults skipped medical care because they couldn't afford it, and people also couldn't afford to buy drugs. These collective changes, no underinsured and uninsured, means every man, woman, and child can get the health care they need when they need it with no worries about cost. No person will have to miss getting medical care or getting drugs because they can't afford it. I think that this is one way that Medicare for All will have a positive, profound impact on people's lives. Now it's time to transition to talking about choice, specifically choosing your doctor or other medical provider. Here are the problems. It's standard for health insurance plans to limit doctor and hospital choice with restrictive networks. In addition, you could be forced to change doctors because your employer changes your policy or health insurance company, you change jobs, your doctor's contract with your health insurer ends and the company does not renew the contract, you lose your job. Whatever the reason, you are forced to change doctors when you don't want to. Medicare for All provides more freedom when it comes to doctors. First, you can pick any doctor within the Medicare for All network, which for all practical purposes will be almost all doctors. Second, you won't be forced to change doctors because you changed jobs or because your employer or your health insurance company made an arbitrary decision. Third, if you lose your job, you won't lose your health coverage and you can keep the doctors you were using. There is another important point about doctor choice. Health insurance, at least before the age of 65, is for the most part regulated by the states. If I think that the best doctor for my problem is in another state, there is a good chance that that particular doctor is not in my network. With Medicare for All, I could go to that doctor in a different state. These same restrictions also apply to hospitals. And the same freedom provided under Medicare for All with doctors also applies to hospitals. So Medicare for All provides more freedom because you can choose any doctor and because you won't have to change doctors because somebody else made an arbitrary decision. Let me repeat that. Medicare for All provides more freedom because you can choose any doctor and because you won't have to change doctors because somebody else made an arbitrary decision. Not only does Medicare for All provide more freedom to choose your own doctor, but it also provides more freedom for you and your doctor to decide the best treatments. Here is one example. I interviewed Dr. Victoria Dooley in a previous podcast. She stated that she often had to argue with insurance companies to get patients the treatment that they needed. Dr. Dooley tells of her experience when fighting for a patient with asthma.
Joe, I have a patient, very, very bad asthma, was on prednisone because of it. And prednisone long-term has a ton of devastating side effects, weight gain, diabetes, just a ton of horrible things can happen. We finally found an inhaler that worked for her. Her insurance paid for it. She was doing great, not coming to the office in the ER every month, every other month for a bad asthma attack. She has the same insurance, but from year to year, they can change what they decide to cover. She hasn't switched jobs. She hasn't switched insurance plans. It's just her insurance decided that they don't want to pay for that inhaler anymore. So you guess what? Now she's on another inhaler that doesn't work as well. And she can't breathe good. She's in my office. She's on steroids, which have dozens of side effects, going to the ER, all for a problem that we solved with certain medication that she was on. All of a sudden, the insurance company decides we're not going to pay for that medication anymore. I spent an hour on the phone with that company trying to find out what's going on. How can we get this covered? Why did they deny it? After an hour, at the end of an hour, going through different people, trying to find out how can I get my patient the medication they need. At the end of the day, they say, oh, it's out of our hands. It's not our fault. Her employer decided not to pay for this medication.
I have lost count how many times doctors have told me that patients ask, how much will this cost? I have also lost count of how many times doctors have told me that they or their staffs spend hours each week fighting insurance companies to get their patients' treatments or medications approved, sometimes with success and sometimes not. Medicare for All will provide the freedom for you and your doctor to decide the best course of treatment without interference from your insurance company or your employer. This will mean no more waiting for an insurance company to approve your care. I think an often overlooked benefit of Medicare for All is that it will provide more economic choice. This will happen in at least two ways. First, it will provide the freedom for you to change jobs or start your own business. You will no longer need to stay in jobs because you can't afford to lose their health insurance. If you want to start your own business, health coverage will no longer be a concern because you will always have it. Second, it will increase disposable income for most people. It is true that Medicare for All will raise taxes, but any increase in taxes is more than offset by eliminating premiums and out-of-pocket costs for health care. More than 90% of the population will likely see their disposable incomes increase, and often by substantial amounts. According to one expert, a family that makes $65,000 per year will see their spending money increase by more than $9,000. I would like to conclude by emphasizing that Medicare for All will make your life better in several important ways. It will eliminate cost worries when getting health care or medications. It will provide the freedom to choose any doctor and allow your doctor and you to decide the best course of treatments for your medical needs. It will provide you the freedom to change jobs without having to worry about health coverage. It will provide more disposable income for more than 90% of the population. There are other proposals to change our healthcare system, but only Medicare for All provides all the benefits that I have discussed that will make life better. This makes Medicare for All the unparalleled choice for better healthcare, and this does not even include many other benefits that Medicare for All will provide. Thank you for listening. You have been listening to Medicare for All Explained. Remember to tell your family, friends, and colleagues about this podcast. Information about Medicare for All Explained can be found at our website, medicareforallexplained.org. The music for this show is Super Bubbly by Jesse Spillane. The logo was created by Lily Sparks. Thank you for listening.